All right, hello and welcome back. I'm Eric Sunset, your host of the Doc Buddy Journal. Here at Doc Buddy, we deliver healthcare solutions that take the pain and cost out of broken workflows, like with our OpNote solution, which gives ASCs the power of instantly generated operative reports approved from the point of care. You can learn more about OpNote and all of our solutions at docbuddy.com. And today we've got a great guest. We're joined by Lori Griffith of Corazon Inc. Lori's got over 20 years of surgical services and operations management experience across all of healthcare, including the ASC. Her expertise includes cost containment, operations performance, and staff development, and she's also held the role of administrator and head of business development for various surgery centers. Lori, thanks for joining the show. We're glad to have you.
Thanks. I'm very glad to be here to talk about the ASCs today.
It's a hot topic. It's a hot space. We love operating here in the ASC. And before we kind of get into the meat of our episode, what else should listeners know about you and your work at Corazon?
Well, Eric, I'm an RN. I've been in surgical services, I think, my whole career, from tertiary hospitals, teaching centers to the ASC. I've spent the last 20 years in the ASC, and I love the ASC. It is the way of the future. So, um, I'll try to keep my comments to our time limit here because I could talk about the ASC all day.
You're in good company. Before we started to record, we even said this is one of the like really the only venue in healthcare where the patient and the provider and the payer, we can't leave out the payer, are in total alignment. And that is just, it's so exciting. You see the amount of wasted spend on healthcare in the US and just the mammoth amount of money that Americans put into their healthcare. So we love it as well. And I'm sure over 20 years, you've seen a lot change. What are some of the highlights over that span?
Oh, really, the highlights I would have to say are the complexity of procedures that have moved to the ASC. In because I've been doing this a long time in the ASC. We were first starting out with ophthalmology procedures, cataracts, and such. And our total joints were in the hospital for 5 to 7 days. We did ACLs and kept them overnight, rotator cuffs, and now all of that's in the ASC. And, as we get into this conversation, surprising that cardiac procedures now are in the ASC. I mean, they've been done on a limited outpatient basis for many years, but now that they've moved out of the hospital, and I think that is just amazing. And what's anticipated to continue to come down the pike is just absolutely incredible.
We definitely are going to talk about cardiac in the ASC. And Lori, I think I cut you off just in time before telling us a little bit about your work and what Corazon does for healthcare organizations. So before we dive into our, one of our favorite topics, cardiac and the ASC, tell us a little bit about Corazon.
Corazon's a national consulting firm, and we work in a very niched area. We specialize in service line areas, such as our main service line area is cardiovascular. We started in cardiovascular, and we've since expanded our footprint to neurosciences, orthopedics, spine, and surgical services. And I think it was probably a year or two ago that we really formally launched our surgical services platform, and particularly the ASC. We've always been in those spaces, but we officially launched that. We help organizations with implementing programs, doing business planning, strategic planning, and we also do some recruit physician and administrative recruitment. We can accredit cardiac programs. So we do a lot of work in those very specialized areas.
Well, you've got to be even more excited than we are at Doc Buddy that IPO list, the inpatient only list, is getting shorter. It seems like every day that passes, we love that. And as a patient, and at some point we'll all be a consumer of healthcare somewhere along the line. And I know, just speaking from personal experience, having that procedure done in the ASC, I would pick that 100 times out of 100 than going into the hospital and dealing with all of the logistics and the hurdles that brings. And related to that IPO list, obviously cardiac procedures are the ones that are generating a ton of buzz this year. So what are you seeing? What's the state of play now with cardiac and the ASC, and then where are we going?
So yeah, it was probably, I think, back in 2019, the first cardiac procedures were approved by CMS to move into the ASC, and they were really those diagnostic procedures, those right heart cath, left heart cath type of procedures. And then it, 2021, they approved the coronary interventions in the ASC. And, we can do device implants, pacemakers, defibrillators, things like that. And peripheral vascular has been done in the outpatient space for quite some time. Exciting though, we are anticipating in the very near future, 2025, 26 maybe, having additional procedures added to that list. And we're looking at, some ablation, EP ablation procedures to move to the ASC. And there's talk in the future that with, advances in technology, that even the structural heart procedures possibly could move to the ASC, the TAVRs and such, which I'm from back in the day when anybody that had any cardiac procedure, you had your chest opened up. And now that they can do those through a vein or an artery and do them outpatient, it's just incredible. So that's what we're anticipating. Again, as you said, more and more moving out of the hospital to the ASC.
That's huge. I mean, the advances in technology are just mind-boggling to me. A simple marketing and business development professional, when you're talking about doing cardiac procedures in the ASC, obviously safety is paramount for any surgery. But where it may seem like a little bit more of a no-brainer, that yeah, we can fix that ACL. We don't need to be in the hospital for that. We're talking about the heart. That's a mission critical piece of muscle in the human body, obviously. So as you're looking at these more advanced and not invasive, I'm not going to use the right terminology here, but bringing more advanced cardiac procedures to the ASC, what are you telling your centers in terms of safety, or how are you setting that bar that yes, we have the technology to do it, but here are the things that you need to be doing?
The expectation when these procedures are moved from the hospital to the ASC is that the safety and regulatory requirements are going to be equal or more than they would be in a hospital. And we partner and collaborate with SCI, which is the professional organization for interventional physicians and procedures. And we've worked very closely with them to establish our accreditation guidelines. And there's clear societal recommendations for what can be done in the ASC setting, and or sites that don't have open heart surgery capabilities, and particularly patient selection is one of the very key points of safely doing procedures in the ASC. And they've established some very clear guidelines for risk assessment and patient selection criteria to understand which patients can safely be done in an ASC and which ones should be done in a hospital.
Well, going back to that alignment related to what you just said around patient selection, but the alignment of the patient, the provider, and the payer, there's obviously a choice component in that, on the patient side as well as on the surgeon, the cardiologist side of this. What if any pushback do you get from patients that, yep, we can do this cardiac procedure in the ASC, it's outpatient, and you get the sort of the blank stare back that like, yeah, but this is my heart. I want to do it in the hospital. What do you say to that?
We've that's come up, and I'm glad you asked that question, because physicians even that are just entering this, bringing, considering bringing cardiac into their ASC, or how am I going to convince my patients that this is okay? And most patients, I have to say, are happy to know that they can have a procedure done in the ASC. We've had to do some education for state health departments that establish guidelines and rules for the state. We've done education for them so that they can also understand that there's been much research and studies done to prove that these procedures are very safe in the ASC.
Absolutely, yeah. I know, in having Bill Prentice, the president of ASCA, on the show in the recent past, that awareness at the patient level that the ASC is even a choice is one of the key initiatives for ASCA to broaden the reach and availability of ASC procedures to patients. So I would imagine, it's a fairly run of the mill thing for a joint procedure, something ortho or spine or pain management or retinas, like you said, been
Mhm.
around a long time. But the heart being sort of a newer, or the ASC being a relatively newer venue of care, and then patient choice, that seems like it'll be a big hurdle to clear, or potentially a big hurdle to clear.
I think most patients, when they have a relationship with their physician and have the trust in their physician, they're going to go where their physician recommends. And even those patients who really aren't candidates for whatever reason to be done in the ASC, they seem to still ask, Can my procedure be done in the ASC? And then there's a conversation, obviously, about, we need to do this in the place that's best and safest for you. But patients still ask, can I go to the ASC?
Yeah, and I don't mean to come across as a skeptic. I'm not. I'm a card carrying member of the ASCA and ASC fan club. So I'm sure they leave thinking, man, that was easy. That was really easy. And, one of the keys to that is the efficiency, not only for the patient of having procedures done in the ASC, but the efficiency for the provider, as well as their surgical teams. But efficiency is kind of the watchword for the ASC. You can't have open ORs that had a procedure canceled at the last minute. You need to be really running a tight ship to make sure that your ASC is operating optimally, both in a patient care sense as well as in a revenue sense. And I know you see that every day. What are some of your keys for your clients?
Right. That's something that we look really closely at. And as a former ASC administrator, you're correct. That's one of the key components of having a successful center is that efficiency. Our margins are much tighter in the ASC. The reimbursement's less than the hospital. And in my experience, when particularly when hospitals have joint ventured or on an ASC, they're very concerned about these revenue generating cases moving out of the hospital to the ASC, and then potential owners of an ASC. Well, we're going to get less revenue, and yes, the reimbursements are less, but that's why you need to be efficient because your cost per case is lower in the ASC. You don't have the overhead that a hospital would have, and the staffing model is leaner. You don't have as many support staff that's necessary. Obviously, everyone that needs to be there is there, but you just don't have as many. And
Mhm.
you look really closely at your insurance contracts and your supply costs and how you're you know, evaluating your processes to move patients and operationalize your surgery schedule efficiently for the patient, and they appreciate it. I'm going to tell you, it is a very it's I call it a dance. How do I do this procedure or make this patient's experience very efficient, but also make them feel like they have gotten very personal, very individualized one-on-one care? That I knew your name. I didn't know you're just here for your hey, that's the total hip patient. The nurses know your name. So how do we balance those things? That efficiency, but that personal and individualized experience is kind of the beauty of the ASC, and those are the ones that are successful.
And you mentioned another sort of hot topic or dog whistle for me around staffing. That ASCs are having to do more really with less staff than they've ever had in an already lean environment. it's tough to hire folks. It's tough to retain folks. There's always a bigger paycheck waiting at the hospital if you're willing to work at the hospital, obviously. So when you see that, when there's maybe not enough front desk staff, or there's not enough surgical techs or whatever, and you're having to manipulate the schedule based on lean staffing. Obviously, we hope that's not the case for any surgery center and for the patients seeking treatment there. But the reality is it's really tough to hire folks and to keep help at the surgery center in 2024. What do you do to navigate that?
Staffing's been difficult since COVID for everyone. Um, I would say it was the first time that I ever experienced having maybe a little bit more challenge hiring folks than I did before. Um, with that said, though, it's most often a very attractive position to have. If you're wanting the higher dollar salary, you probably need to be at the hospital, but the surgery centers do offer staff a very attractive lifestyle, quality of life. It's, Monday through Friday and typically no weekends and such. But usually you're going to have a very experienced staff, very seasoned people, and they often function in different roles. You wear a lot of different hats in the ASC, where in the hospital, you may be just a pre-op and recovery room nurse, but in the ASC, you may also do pain procedures or work in GI. So very versatile. And it's a much more cohesive, in my opinion and experience, a cohesive group of people that work really hard, but work together. We all have the same goal of giving really, really great, excellent care to these patients, but finishing up the day at a reasonable time. So there's no second shift coming in to relieve us. So we need to finish. So we work together to get that done. So it's really, I wish some of those ideas could translate to the hospital sometime. But then, maybe the physicians would enjoy being at the hospital more, but they typically love the ASC as much as the patients do.
Well, that's interesting. And I've never worked in an ASC or in a hospital. It may shock you to hear that, but as a whole, it seems like culture, and you hit on it, the sort of the work life balance Monday through Friday. There's a definite end to the day, finishing strong and making sure everybody is cleared out. It needs to be cleared out. Contrasted with the hospital, that doesn't seem to be the case. And I'm taking you a little bit off topic here,
Okay.
but if you are willing to sort of, and these are my words, not yours, but sell your soul for the higher hospital paycheck versus that better culture, the more team oriented sentiment that seems to be present at the ASC, that seems to be a big difference. And I've heard that over the last several months and talking about this through this hiring sort of tough landscape.
I think it is a big difference. Many people think, though, I'm going to go to work at the ASC and that'll be my nice retirement job. You work very hard in the ASC, and that's again because you need to be very versatile and do lots of different things. You don't typically call housekeeping to turn over your room. You're the one turning over your own room. So you work really hard, but there's an end to the day, and you're not going to get called out in the middle of the night to come in for something. You sleep better, but it's just very gratifying that you have patients that for that brief moment of time, you've actually have a relationship with that patient. It's in that little soundbite of time. And I've had patients recognize some of my former nurses out in the public. I remember you. You took care of me in the ASC. So I think that's telling.
Yeah, it absolutely is. And I'm gonna pivot us back to the overarching theme here of efficiency too. So you've got this better culture, and these are my words again. I wouldn't know, but the better culture at the ASC, more maybe more teamwork oriented. And as you said, if you want this room turned, well, who better than you to do it? Put your gloves on and get it taken care of. But this efficiency aspect, technology plays a role in all of healthcare. Sometimes it's good technology that's helpful. A lot of times it's not. So when you look at the ASC as a whole, the entire space, not a ton of ASCs are totally digital. They certainly all have a practice management software that handles their scheduling and their patient billing and accounts and things of that nature. But in terms of electronic health records, be they the full boat, so everything's digital from pre-op out to PACU and everything in between, or maybe just a piece of this clinical aspect, where do you see good digitization of ASCs? Where isn't it so good? Where is paper an advantage? Where's paper a disadvantage? Just really looking for your broad stroke kind of thoughts here.
Okay, so personally, I love being all electronic. You get much better data and you can make better decisions with better data. Obviously, I've been on the paper side when the schedule was done on paper and all documentation was done on paper, and there's still some nurses that, oh, when you switch over to computer, I'm done. That's when I quit, because I just don't like computers. They usually buy into it after a little while, but it certainly helps you be more efficient as well with being able to understand your supplies and your ordering. And being timely, and then assessing your efficiency. How long are these cases taking? What's my turnover? How many am I doing? How to optimize your schedule, and how many cases can I put on during a day? On paper, that is virtually impossible to analyze all of that, but with an electronic medical record and the whole complete system, it makes you so much better. So I'm absolutely an advocate for that. And I know it's often a large expense, and some of the freestanding, smaller surgery centers, that's a huge commitment for them. But I believe in the long run, it pays for itself because of the information you can get from it.
Yeah, like you said, the optimization of scheduling and knowing your times, everything's time stamped in software, whereas on paper it's anybody's guess if it's written down or not. But this, I think, ties directly back to reimbursement as well, or at least revenue for the facility. That if you're able to tie supply costs and implant costs, devices, whatever has to be a part of a procedure, and know, like, hey, when it's this insurance and we're doing this procedure and using these things, we're in the black. But for this insurance carrier with this particular implant or device or whatever it is, we actually don't make money on these cases. Being able to separate the
Right.
wheat from the chaff, really tough to do on paper. But that kind of brings us to the broader discussion point around reimbursement. And I cut you off there. Sorry, go
That's
ahead.
okay. I wanted to add that the electronic records also are assisting us with reporting our quality.
Yeah.
When you have to do chart reviews manually on paper to determine any quality measures that require reporting, it's very difficult. And the surgery centers have there are a lot of requirements for quality reporting. So having that ability to do that electronically is so much. I mean, it's night and day.
Well, because you said that, let's put our tinfoil hats on, or I'll put mine on. You maybe don't need to put yours on. But obviously, in the practice side of the world and the hospital side of the world, going on 15 years or so now, CMS said you're going to use these electronic health records or else. And the or else was obviously less reimbursement. What do you think will happen there? Because as these procedures come off the IPO list, the inpatient only list, we're talking about Medicare procedures in this case. Do you think there's a future where CMS says we're not getting any data out of the ASC, or we are, better phrased, we're not getting as much data as we could from the ASC because so many facilities are not using an EHR of any type? Do you think there's a future where CMS puts its foot down again and says it's time to digitize the ASC or
Yeah.
else?
Yes, I do. I do. If they transition it in and say any new ASC, it's required from the start, and give established ASCs a period of time to make that transition. I'm not sure, but yes, I do. I do believe it'll be mandatory.
Yeah, and like you said, that puts these facilities between a rock and a hard place, especially the independently owned facilities. You've got surgeons who are on their fourth or fifth or even higher EHR at their clinic because it took that long to find one that they actually liked. You have the expense, you have the training and learning curve that goes along with it. I'll be curious to see the reaction if that does happen. And I agree with you. I think it will. But hey, I've already bought a half dozen of these. And now I need to buy one for my ASC, which doesn't make as much money as if I did these procedures at the hospital anyway.
Well,
But
the nice thing is when we first started on electronic records in the ASC, it was the product was more, we're going to take this hospital platform and put it in the ASC. And it's been a long time coming, but it's been developed more and more specific platforms to the ASC and companies that specialize in the ASC platform to make it again more efficient for the ASC. So that's improved tremendously.
yeah, I certainly wouldn't envy any ASC being asked or forced to put the hospital's EHR into their facility. Like you said, it's just not built for that. It's not built for all the efficiency that an ASC really has to have. And that's, to bring us back to reimbursement, that's one of the key points for payers helping and asking and begging to move procedures from the hospital to the ASC. What are the implications of that? Payers looking at the price of an HOPD procedure versus an ASC procedure. What does that mean for the owners of the ASCs, for patients, the whole supply chain?
Well, you want to have great contracts with your insurance providers. The insurance providers want as many procedures in the ASC as well. It's a lower cost, high quality setting of care. The patients typically have lower copays when it's in the ASC. So, again, all of those things are very favorable financially. And I know there's numbers out there and I can't state them specifically, but I know it's in the billions of dollars that these procedures being performed in an ASC has saved Medicare. So it's a big deal.
It is a big deal, and not to sound too nationalistic here, but we talked before recording about the massive amount of money that we spend on healthcare in the U.S. Trillions of dollars. And if you look at the data and the reporting, a quarter of these trillions of dollars spent on healthcare in the U.S. is attributable to waste and administrative complexity. And you hear that and you just go, how could that possibly be? And this is a long walk for a short drink of water, Lori, but the ASC is the shining star in U.S. healthcare. What will it take for these other venues of care, be it the practice or be it the hospital, to get more into an ASC mindset? And if they did, would it matter?
Well, I think everybody needs to be thinking about that. I think physicians' practices are probably closer to having that efficient mindset than the hospitals. Unfortunately, as for the hospital, as more procedures move to the ASC, it's left the much more complex and sicker patients at the hospital. So makes it a bit more challenging to try and be as efficient. But I think of course, they want to and they try, but it's just a lot more difficult.
You hit on a key point there. That like value-based care, I think, is one of the ways that the practice, becomes more ASC like in its efficiency. But if you're leaving only the sickest patients with the most comorbidities or other complications to the hospital, like how does value-based care fit in there? They're not going to get a fair shake dealing with the very sickest part of the patient population.
Right. And organizations that don't have an ambulatory strategy, be it an ASC or moving diagnostic testing, imaging and such to an ambulatory setting, you're behind the curve. If you don't have a plan, you're missing the boat.
Yeah. Well, and not only from an organizational perspective or point of view that you're missing the boat, but patients, and I can speak to this as a patient myself. You look at the price of some of these procedures that don't need to necessarily be in the hospital, and it's feels like 10 times more or 100 times more even. Like, why does this simple diagnostic cost this much? It feels, and maybe this is just my own bubble, but it feels like we're at a breaking point for the price of healthcare just as a regular patient.
Hmm. I agree. And I also, I would say, when hospitals are considering, should we do this? Should we have an ASC? We're going to, lose all this revenue. I would say, what are you going to lose if you don't? Because
Mm.
if you don't do it, somebody else is going to come in your market and do it. So, do you want to partner or on your own, or partner with someone to go into this ambulatory strategy, or not do it at all and let somebody else do it instead of you? So, um, I think people have to be organizations need to be forward thinking in that regard.
Yeah, and I would imagine that comes from the C-suite on down. I'm sure providers are voicing their concerns, but if it's not coming from the top, you're going to be left in the dust.
Right. Exactly.
So turning our gaze back to the ASC, we hit on some of the biggies here: cardiac procedures, the efficiency, how technology can play into both efficiency and a stronger bottom line. What haven't we covered that we should have?
I think just this is the way of the future. This is what patients want. This is what providers want. It's what the insurance wants. It's safe. It's high quality. I think this that the ASC is the way of the future. So um, I think that kind of says it all, really.
Absolutely. I know you are on the road quite a bit, helping your clients with Corazon. Will you be attending any of the state association shows for ASCs, or too busy with client work through those?
No, actually, it was last year. Was you know happy to attend the ASCA conference in Louisville, and it was great. I love that conference. It keeps people current on things that are changing, and anyone in healthcare knows things can change with the direction of the wind. I encourage people to participate in their state ambulatory surgery association as well. Um, Regulations still vary state by state. So again, it's good to have those contacts. Sometimes the ASC, you feel kind of like you're on an island out there all by yourself. In the hospital, you have other people watching those things, but in the ASC, you you're it. So having those relationships and ability to collaborate with other ASC professionals is critical.
Well, and this is really timely and not planned or scripted in any way, I promise. But ASCA 2025 just opened its registration. In 2025, will be in Denver at the brand new Denver Gaylord Hotel. And I would highly encourage you to visit the ASCA website, check that out. Couldn't be more convenient either if you're familiar with the area. You fly into the Denver airport, DIA, and then the Gaylord is 10 minutes away. It's a fantastic venue, and Doc Buddy, of course, will be there.
Oh, that's lovely. Denver, so what a nice place to go. So
I agree. That's my home state, so always fun to have a reason to visit.
great.
And Lori, before we close out here, where can listeners connect with you online? Your website? Where would you point people to?
Well, I would point people to our website online, corazoninc.com, and we also have our page on LinkedIn, our company page. I'm on LinkedIn. I encourage, if anyone has any further questions or would like to get in contact with the company or myself personally. Uh, Either way, you can contact through our webpage or through LinkedIn.
And listeners of the show will know that those links will be in the description of the show notes. So you'll be able to click right to Lori, right to Corazon Inc. Lori, thanks so much for your time today.
Oh, it was great. As I say, I love talking about the ASC, so was very happy to be invited and have that chance.
This has been great. And on behalf of the entire Doc Buddy team, I want to say thank you for listening. Be sure you're subscribed on Apple Podcasts, Spotify, and YouTube so you always get the newest episodes of the show. And until next time, I'm your host, Eric. We'll talk again soon.